Hello. Dr. Silva here. We're about to do a PRP treatment to the cervical spine. This patient has been complaining of neck pain after falling during a ski adventure. She got some x-rays done and it was found that there really wasn't a whole lot of arthritis or disc disease, things that doctors commonly look for, yet she still has pain. So what we're going to be doing is a PRP treatment to a lot of the ligaments that were most likely injured during her ski accident. Those ligaments will be the supraspinous interspinous ligaments along the middle of the spine, and then as well the capsular ligaments that line the bilateral facet joints. Additionally, there's a lot of muscles that attach to the base of the skull and into the neck region, all along towards the shoulder region. And so we're going to identify some of those attachment points here at the C1 and C2 spinous process. And everything we do is going to be done either under fluoroscopic guidance or ultrasound guidance. That way there's no question where PRP is going. Save image. Yeah. Many times you'll see people doing injections similar, but they're just not targeting these specific tissues. They might actually be feeling the bony prominence and they're kind of injecting, thinking they're in a certain area, but there's no way to be sure unless you have confirmation under image guidance. So that's what we're going to do today. And do you think you're ready to get started? Yeah. All right. And it's really important to understand that these injectates should be custom made to your condition. So if you have severe disease, your concentration of platelets should be much higher than somebody who has mild disease. Still, PRP. And muscles certainly don't appreciate platelets as much as ligaments and tendons do. So we would keep those platelet concentrations much, much lower. Nerves also need something a little more specialized for that type of tissue. Bone as well, something different than what cartilage would get. And so in every location, as you see as I'm injecting this cervical spine, each location and each tissue has a custom concentration and type of injectation. Okay, there's C1, 2. There's 2, 3. Awesome. Great. Nice flow. Just treated the C1, 2 joint. And on fluoroscopy, you can see the joint space. You can see the contrast flow inside the joint. So there is no question where that PRP went. It went directly into the C1, 2 joint.
That's pretty intense, but like super relaxed and nice.
Contrast. C2, 3 level for you on the left. It's definitely, all right, pinch poke. A little more irregular and difficult to approach.
There's like a cooling sensation as you're injecting.
Okay.
That was great.
All right. Glad you enjoyed it. All right, well, we got another successful treatment to the cervical spine and a left wrist treatment as well. And we'll follow up with this patient after about 10 weeks. 9 or 10 weeks is usually the time that people tend to find the most amount of benefit, although benefits can still be after that time frame. Now, we want to make sure this patient is comfortable. She'll have a little bit of swelling and discomfort for the next couple of days, a little increased stiffness in the neck. That should all get better every day after tomorrow. In my practice, we always want to make sure our patients are comfortable and safe and that we have good pain control afterwards. She had good pain control during the procedure, and there was no sign that she was traumatized by that kind of procedure. Although it was very intense, we treated a lot of structures and a lot of different levels. She actually was quite comfortable throughout it, and that makes me happy.